Hello everyone, myself Sijo. Today I'm going to present on the topic brain gates. You may be unfamiliar with this topic, so let's say what is a brain gate. Brain gate. A brain gate is a brain implant system developed by the biotech company. With the brain gate system, the brain computer interface is enabled to a patient suffering with a severe paralysis or other neurological conditions to live more independently. The computer chip that's implanted into the brain monitors brain's activity in the patient and converts the intention of the user into a computer command. There are about 100 hair-thin electrodes that sense the electromagnetic pulse of a neuron that act along a specific area of the brain. The activity is translated into electrically charged signal and is then sent and decoded using a program which can move a robotic arm or a computer cursor. BrainGate is the first human device that has been designed to record, filter, and amplify multiple channels of simultaneously recorded neural activity at a very high spatial and temporal resolution. Now, let's see how a normal neural activity occurs in a person's brain. Dendrites. It is responsible for the occurrence of the electrical signals or the nerve impulses in the neuron cell of a human body. Axons. Nerve impulses are carried through axons from the neuron cell body. It causes the neurotransmission to occur. Neuron muscular junction. The signal is passed by the neurotransmitters from the neurons to muscle fibers. The muscle fibers then react to the signal, causing the body to respond. Now, let's see the working of a brain gate. There are four essential parts for the working of a brain gate: the chip, the connector, the converter, the computer. The chip. When the person thinks of doing something, electrodes on the silicon chip implanted into the person's brain dictate the neural activity. The connectors. The neural signals thus detected by the chip is transmitted through the pedestal plug attached to the skull. The converter. The signal thus occurred is transferred to an amplifier where it is converted to an optical data and is given to a computer with an optic fiber cable. The computer. The brain gate learns to associate the pattern of brain activity with particular image movements and connects those movements to a cursor. When the person thinks of moving the computer cursor, electrodes on the silicon chip implanted into the person's brain detect the neural activity. The impulses transfer from the chip to a pedestal protruding through connecting wires. The pedestal filters out the unwanted signals and then transfers the signal to an amplifier. The signal is captured and sent through an optical fiber cable to a computer. The computer then translates the given signal, which causes the cursor to move. Brain-computer interface that consists of an internal sensor to detect the brain cell activity and external processor that converts this brain signal into a computer-mediated output. The sensor is implanted on the brain where they pick up the electrical signals known as the neural spiking, the language of the brain, from nearby neurons and transmit them through a thin gold wires to a titanium pedestal that protrudes about an inch above the patient's scalp. An external cable connects the pedestal to the computer, signal processors, and monitor. The technology is able to sense the electrical activity of many individual neurons at one time, and the data is transferred from the neurons to the computer where the signal is analyzed and the thoughts are used to control an external device. Sometimes these electrical signals would somehow try to escape. The scientists could detect the signal, interrupt what they mean, and use them to direct the signal course. Now, let's take a look at the advantages of the brain gate. The brain gate could remain safely implanted in the brain for at least 2 years. It's easily removable. The language of the brain that can be recorded, routed outside the human brain, and decoded into command signals. Paralyzed human can directly and successfully control external devices such as a computer cursor using this neural command signal. The speed, accuracy, and precision of the brain gate is similar to that of a normal working of a person's brain. Now, let's see the disadvantages of the brain gate. The currently available brain gate has a bulky appearances with a cables and processors. The size has to be reduced to make sure that it is compatible use. Presently, it is essential to recalibrate the device after one's use. As per the current use, we cannot have a direct connection from the computer to your muscles. Now, let's see the applications of the BrainGate. The BrainGate neural interface system has improved the quality of life for physically disabled people by allowing them to quickly and reliably control a wide range of devices by thought. Cyberkinetics is also developing products to allow for a robotic control, such as a thought-controlled wheelchair. Maybe in the future, we could adopt this method for changing a TV channel with a mind, or control video games using your thoughts. So far, we have saw what's a brain gate and how it works. The primary goal of this technology is to help those who are paralyzed to perform daily routine activities that are a part of a normal human existence. The BrainGate device can provide paralyzed patients a mode of communication through the transition of a thought into direct computer signal. So that's all about the topic BrainGate. Hope you all like the presentation. Thank you for listening.